This video shows how the Batavia Veterans Home dramatically reduced staff injuries and lost workdays by implementing a comprehensive zero-lift program. Changing from manual to mechanical lifting resulted in fewer employees out on workers' compensation, reduced overtime, and improved morale for both staff and patients. The video shows how the zero-lift program was implemented through a series of steps that could be undertaken at other direct care facilities. You will also learn about resources available to help you begin this important program.
A fifth of our workforce was out on workers' comp due to injuries that they received as a result of just going to work during the day.
Healthcare workers have the highest rate of injury, even higher than truck drivers and construction workers.
You know, they tried to lift him out of bed and I could just see my dad just grimace. It was brutal. It was awful. Nobody should have to go through that. My dad's quality of life changed immensely when he came to the New York State Vets Home.
I'm not like an elderly person that they're fragile, but I feel it would hurt.
And safe patient handling answers all that. It's a win-win situation for both labor and management and the resident.
Before we had the safe patient handling program at Batavia, we were struggling with a number of issues. Our staffing, particularly certified nursing assistants, was such that we were required to mandate staff to stay after their scheduled shift in order to provide the care for our veterans. And this was causing both issues with resident care, but also it was just horrible for our staff. People would come to work, they couldn't go home after work because they had to stay another shift. Morale didn't exist. We had a 48% turnover rate in certified nursing assistant positions. We tried a lot of different things. We did things like, giving people rewards, whatever we could think of to try to resolve this issue. And nothing worked.
Before zero lift, you never knew whether you're going to walk out the door healthy, mandated. Morale was really, really low. I would leave after my 8-hour shift exhausted, more exhausted than I ever worked in an 8-hour shift in construction.
There were a lot of injuries. They missed time off from work. A couple of them couldn't even come back to this kind of work again.
Because I remember we mandated almost every other day, and we missed a lot of activities in our family.
Before, you were just tossed in the chair and lifted and all this too, and over here I feel I have more dignity in that too.
I mean, I really don't know what to do about this situation. Everything that we tried didn't work.
Safe patient handling and movement is a policy and practice that creates a safe environment for patients and healthcare workers by eliminating hazardous manual lifting tasks. Transferring and repositioning patients is accomplished by using new technologies in mechanical lifts and repositioning devices.
When I went to my first safe patient handling seminar, I knew, this is the answer.
It became really clear to me that the injuries that our staff were getting at work were real, devastating, life-altering, and what we were asking them to do as part of their job was hurting them. I had no idea that the benefit of doing this program was going to have such a positive impact on so many aspects of what we do in this facility.
They're able to use this equipment, and the equipment puts you where you need to be put, and it don't hurt you, and that's nice. And there's a lot of times people have to be lifted to the darndest places.
A successful program takes more than just having equipment. It takes commitment from top management and complete involvement of workers throughout a facility to put the pieces of a successful program together. This means setting clear policy statements that are supported by top management, where clear goals and expectations are set, and managers and workers are held accountable. It means dedicating resources for equipment and training, and performing ongoing evaluation and continuous improvement.
People in the business office, in central supply, in food service, every single person has a role in making the program be a success, and it's actually included in everybody's performance program. We do business here with the Safe Patient Handling Program, just like we do infection control, just like we do fire safety and emergency preparedness. Safe patient handling is one of our core business values. It is a reality of the program that you have to have the equipment available. If people can't access it, or if it is in disrepair, or if it is unsafe, people would not use it, and we wouldn't expect them to. Looking back at our statistics, we went from the equivalent of 9 FTEs out on workers' comp. Last year, in 2010, we had the equivalent of 0.5, a half of a person out related to lifting, pulling, moving residents. The equipment pays for itself, there's no question. I mean, within a year or two, that was, it's worth the investment.
You know, you have to be persistent. You could hire all the help you wanted. The injuries are still going to occur because of the manual lifting. The concept of safe patient handling made sense to me as an officer and people I represented.
We had a lot of different departments working together to achieve the Zero Lift program. There was PT, there was OT, there was nursing, and there was all different levels of nursing. There was RNs, LPNs, there was nurses' aides. There was also administrative staff, the director of nursing, the administrator, some of the nurse administrators also. And everybody's input was very important. And then once we met as a committee, we did develop subgroups to carry out some of the tasks. There was a very organized timeline of all the things that we needed to do and what subcommittees were responsible for what aspects.
We had to make sure that we had representation from the people that were going to be implementing the program. So we paid people to come to the meeting.
Also, by including all 3 shifts and the naysayers, it helped with the buy-in.
I think from a therapist standpoint, it goes against what you're taught in school. You're taught proper body mechanics, and that this is the way you should transfer and the residents should do all this work. But once we learned about the Zero Lift philosophy, it made much more sense that it's safer for the resident, it's safer for the staff involved, and the resident is still utilizing all their skills.
When we first began safe patient handling, we had a consultant come in, and she would go through the care plans and she would talk to the staff and start to introduce safe patient handling to the staff. At the end of those sessions, she would come back and have this list of paper for me to change care plans. And what we did is we went through all the care plans, and anyone that was a 2 assist, we changed them to either a standing mechanical lift or a total lift or whatever lift was appropriate for them at that time. So we went through 126 residents, 126 care plans, and we blitzed them. We went through everything and changed anything that needed to be changed.
There is a lot of different equipment that was available out there. One of the key things that we did was we actually trialed the equipment.
Frontline caregivers were kind of negative towards it because of the time element involved. But I had assurances from my director of nursing that she would back us up if it came to a point where supervisors are going to write people up or rush people into the dining room. We were told to work in a timely and safe manner. And for the most part, it was a partnership between management and labor.
It was important for our facility to train all staff and to educate them on Zero Lift. We even trained maintenance so that they would know that the equipment needed to be fixed right away when it went down, so that we had the proper equipment for the residents and for the staff to use on the residents.
We do an annual competency for the lift equipment. It includes the total mechanical lift, the ceiling lift, the standing lift, the use of the gate belt, and the slide sheets.
Joanne called it a culture of safety. We get time off, which we never did before. You would have to call in if you wanted time off. It's like a whole different work situation.
And I never really pulled the numbers apart to actually look at what percentage of our injuries for workers' comp as a whole were related to lifting, pulling, moving residents. I don't know why. That just seemed to be, we just accepted that there was a level of injury that was going to occur in healthcare. I can't believe what an impact this program has had on this entire facility and the people that work here and the people that live here. It's crazy. And it is work. You know, it does take time and it does take commitment. It's worth it. And no, we would never go back. We would never go back.
A successful safe patient handling program takes commitment by everyone in a facility to put the pieces together. It takes management commitment, employee involvement, problem identification, and finding solutions, training, and maintaining success and momentum. These pieces make it possible to eliminate the hazard of manual lifting tasks so that injuries are reduced, the facility is fiscally stronger, and the quality of life for residents and workers is improved.
My dad's quality of life changed immensely when he came to the New York State Vets Home. Before he came into any facility, he was able to walk and get around and everything, and then he went to one facility and he couldn't walk and do anything. And then he came in here, and I think he had been here a week or two, and I came in to visit him, and I saw him walking down the hall with the assistance of the lift, and it was just, I think, one of the most moving moments of my life to see the big guy up there walking around. It was awesome.
My legs are getting stronger, and I don't have that pain now from being lifted up.
This is great. This is a good facility. Excellent. I love it here.
We got more opportunity to stay home and get time off, and the zero lift is the best thing that happened to the facility.
Things have changed. It's a lot better now.
The before and after picture of safe patient handling at this facility is that no one would ever choose to go back. Not one person.
It changed everyone's lives for the better. And again, in healthcare, what more really do you want at the end of a day is that people's lives were better in some way. That's really what we do. And the program, the Safe Patient Handling Program, it achieves that every day.
Be sure to check the menu on this DVD to access other important resources. Besides additional video, you will also find the Batavia Veterans Home Safe Patient Handling Program, the application for grant money available through the New York State and CSEA partnership, and links to informative websites.